Hello everyone, good morning. My name is Dr. Anu. So today we'll discuss about intermittent fasting. So what happens when you take some food? So when we have food, food is broken down. Basically food is carbohydrate, protein, fat, right? So food is broken down into sugar particles. So in response to these sugar particles, whenever there is high level of sugars, there is also release of insulin. Okay. So insulin goes, it binds to the sugar, it takes it inside the fat cells and stores it there. Now, what will happen if you're on fasting or if there is no intake of food? The sugar which was stored inside your fat cells will start to come out. Okay, and your fat cells will start to shrink, and that's how we lose weight. Okay, so the basic funda is if you don't put extra food from outside, the body will start to use the deposited fat or the deposited glucose from inside, and you will start to lose the fat. And fasting has been a concept from a very long time in many religions. So there must be something good about it, right? So there are a lot of newer studies which have shown that fasting helps in reducing weight, it helps in increasing your metabolic rate, it helps in reducing the insulin levels. That means the storage will reduce and the use of the existing sugar will increase from your body. It also helps in increasing insulin sensitivity. That means the existing level of insulin in your body are used in a better way now. They work better than before. It has also been seen to be useful in patients who have asthma, who have chronic joint pain. It helps you to provide a better appetite control. So it's a good thing. We can do it, but when you should not do it, you should not do it when you're pregnant, or if you're lactating, if you're a child, or if you're a teenager, because you need a lot of energy to do so many things in your life, right? If you are diabetic, if you're on a lot of medications, you should not go for intermittent fasting. So there are a lot of ways how people go about intermittent fasting. There are few popular methods. One of the popular technique is 16 bar 8 technique. So what is 16 bar 8 technique? You do not eat for 16 hours and you eat for 8 hours in that day. So that means you skip your breakfast and then you start from your lunch time. You do your work, then you have an early dinner and you sleep. So that helps you. Early dinner helps a lot to shed those extra calories. You should control your night cravings. That's how you can make your intermittent fasting even better. Another popular technique is 5 bar 2 technique. So in 5 bar 2 technique, what people do is for 5 days in a week, you eat normally how you eat always. For 2 days in that week, you will have a restricted intake of calorie. That means you will eat maybe 5 to 600 kilocalories rather than eating the whole meals over the week. Another way that people do is 24-hour restriction. That means you don't eat for 24 hours in a week. It might be 1 to 2 days in a week. So I think the easier method would be either 5:2 or 16 bar 8, and that is what is even famous among many people and easier to do and sustain as well. Okay, so how can you make your intermittent fasting more beneficial is do not forget to have healthy food, like have more veggies which have more nutrition, more vitamins, minerals, because you're eating for less time, so you should be able to cover up for your nutrition so that your skin and hair also should not suffer. Then don't go for junk food, oily food, sugar, refined processed food, avoid those. So are there any side effects of intermittent fasting? Yes. So initially when we start intermittent fasting, it's very difficult to sustain it. Why? Because it causes issues like headaches. So headache because of fasting occurs because of hypoglycemia, when your sugar levels are going down. So if your sugar levels are down, you will get to know, because you'll start getting headache in the front part of your head. It will feel like a constricting feeling. So that gives it's a very uncomfortable feeling which tends to stay for some time, but after some time your body will overcome that as well. So the other common effect is sleep disturbance. 15% of the patients might have sleep disturbance when they are fasting. So that also slowly tends to reduce over a period of time. Then another common issue is nausea. You feel like pukish because you're empty stomach for a little longer while, and your stomach is not used to it. It takes little time for you to adjust to that as well. Then bad breath or bad odor from your mouth. That occurs because when we don't eat food for a long period of time, there is release of acetone or ketone bodies, which leads to a bad smell. That is also one of the issues. So, but these all problems are temporary. There is no long-term bad effect which has been seen. Another common problem is irritation. Mood tends to be little down because you're not eating well. And it has been seen that irritability is little more common in women as compared to men. But then it was also seen that women felt more rewarding after they finished their session of fasting rather than men. So it is okay, girls out there. You will overcome that irritated feeling after a period of time. When your glucose level starts to get normal and it comes into your routine, you will not feel that irritated as you used to feel before. So after studying all this, even I feel like giving it a shot. So I also want to try intermittent fasting. I'm just thinking about whether I should go for every day or whether I should go for 2 days in a week. You let me know also what is your plan. Thank you.